Well, good evening. I'm Dr. Peter Van Houten. I work as a family physician and have for the last 30 years. My medical practice is just up the road here from Ananda Sierra Family Medical Clinic. I've also been a practicing yogi for the last 30 years. In fact, pretty much the whole time I've been a family doctor. I've also been meditating and doing the yoga practices that you're learning as part of your course here. What we're going to be talking about tonight is what we understand about the brain and central nervous system and how they can cooperate with our ability to change. In fact, the idea that our brain, the way our nervous system is designed, is somehow an impediment to changing who we are has really been misunderstood. We're realizing now that the brain and central nervous system, in fact, are the most plastic, the most changeable organ in the body. And so what we'll be discussing tonight is what we understand about the scientific evidence around the changeability of the brain and central nervous system, and what we know scientifically are the things that actually help those changes occur. One of the things that is a little unique about our medical practice is we actually do a program called Integrated Behavioral Health. That is, we actually have behavioralists. They're actually licensed therapists on our staff that practice right along with us as medical practitioners, and they're there to help our patients work with whatever changes they're faced with, whether it's smoking cessation or weight loss, or there's someone who's depressed, someone who's grieving. Anyone who's in transition or change would be appropriate for us to include our behavioralist with. So we've, for the last 7 years, have been doing this as an active part of our medical program. So a lot of what you'll hear me talk about tonight is our firsthand experience with working with people day to day. I'm a busy family practitioner. I see 18 to 24 patients a day. And yet we've included this element of behavioral change right into what we're doing. And a lot of what you'll get from us in our discussion tonight has to do with what we've learned from actually watching people go through this process of behavioral change. The first thing for us to talk about tonight really has to do with the changeability, the flexibility of the brain and the central nervous system. You know, I still remember years ago a family member of mine who was in their late 50s saying to me, gee, I'm faced with going to work in this new place, and I'm really nervous about the situation because look at how old I am. You know, you can't teach an old dog new tricks. And that has always stuck with me because I've seen throughout my career in medicine that so often people have this idea that they're sort of stuck in terms of who they are, in terms of their personality, in terms of their behavior, in terms of how they function in different circumstances, what things make them feel anxious, what things make them feel depressed. And really, up until about 30 years ago, there was no reason to think that that wasn't the case. We thought basically, this was up until about 1980, that by the time you hit about 17, age 20, in that range, your brain and central nervous system stopped changing. And basically whatever development your central nervous system was going to have ended somewhere in that time frame, and then that's kind of the way it was for the rest of your life. You were it's almost like Jell-O setting in a Jell-O mold or something, where, or concrete, getting set in a mold. There was this idea that, gosh, by age 30, basically all you were going to do is damage your brain. There wasn't anything you could do to help your brain. That basically, if you had an inherited tendency toward depression or substance abuse or certain kinds of poor health, anxiety disorder, a whole host of things which we know can be inherited, that it looked like there was really nothing you could do about it. Sort of wish the patient good luck. But in fact, that's, I think, part of the reason there was such an emphasis on pharmacology, particularly in that era, was that we really thought there wasn't a whole lot a patient could do to change themselves. Well, much has happened in the last 30 years. We now have excellent scientific evidence that shows not only is the brain changeable, but the brain likes to change. And in fact, really the only question that you have to decide right in this second is, where do you want to be in 6 months? Who do you want to be in 6 months? Because I guarantee the things you are doing right now, your behaviors, your attitudes, the way you're interacting with other people, what positive things you're doing in your life, whether you're meditating, doing yoga postures, being out in nature, things that are regenerative and restorative, all those things that you're doing right now are going to determine how your brain's going to be functioning in 6 months. And we're going to go into a fair amount of detail tonight exactly how those changes occur in the brain and why the brain is so responsive to what's happening in our environment. And you'll also see, as we talk about specific structures within the brain, why some of these areas are so key that if they change, it really changes how we feel about ourselves. It changes our quality of life. It changes the quality of our overall health. We're going to talk a little bit about immune system function and how that interacts with the brain. You'll see there's a lot of connections here, and it also makes quite a bit of sense that the scientific data that we know that surrounds the kinds of changes that you're learning how to do in your course here, why the scientific evidence really can support that. We can actually even look at the structure of the brain and understand how these things are occurring.